Good evening and welcome to our webinar on alternative and complementary therapies for Tourette syndrome. My name is Chelsea Tollner, CDC Program Director, and I will be your moderator for the webinar. This webinar is being provided as part of the Tourette Health and Education Program, a program of the Tourette Association of America in partnership with the CDC. During the webinar, we would be happy to hear from you and include your voice in the conversation. You can ask questions or share comments using the question panel on the right side of your GoToWebinar player at any time. We will collect your questions and address them during the Q&A session at the end of the presentation. I also want to mention that funding for this webinar was made possible by our cooperative agreement with the U.S. Centers for Disease Control and Prevention. The views expressed by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. It is my pleasure to introduce you to our speaker this evening, Dr. Katie Kompoliti. Dr. Kompoliti is a professor of neurology at Rush University Medical Center in Chicago. Dr. Kompoliti was born in Greece and completed her early education there, including medical school. After graduating from the University of Patras, College of Medicine in Greece, she pursued her interest in neuroscience by completing a residency in neurology at Northwestern University in Chicago. Upon the completion of her residency, she held a fellowship in movement disorders at Rush University Medical Center. Following her fellowship, she became faculty in Movement Disorders Department of Neurology at Rush University, where she is currently a professor of neurology. She is the author and co-author of numerous publications. Her clinical interests as a principal investigator have focused on several therapeutic areas, including studies to evaluate the safety and efficacy of new compounds to treat Parkinson's, Tourette syndrome, and functional movement disorders. Furthermore, she is the educational director of the section of movement disorders and the director of movement disorders fellowship at Rush Medical Center. Without further ado, Dr. Kompoliti, please go ahead with your presentation.
Good afternoon. I'm happy to be here today to talk about complementary and alternative therapies for Tourette syndrome. See, this is a very big issue and an issue that it's occupying a lot of what we do as doctors and a lot of what the patients pursue. And I think it's time to join forces in understanding and approaching these treatments. So my learning objectives today are to recognize the demographic impact of complementary and alternative medicine, which is going to be depicted here as CAM, to become acquainted with the gamut of options of complementary and alternative medicine, to review the evidence for Tourette's, to discuss strategies of communication between the healthcare providers and the patients regarding complementary and alternative medicine use, and finally to formulate strategies on how to integrate complementary and alternative medicine options into the comprehensive management of the patient. So let's start with some definitions. So complementary medicine is the medicine that's used together with a mainstream medical care. Hopefully in a balance, as you see here, one side is, the drugs, and the other one side is all the things that are good for you, like the apples and the herbs and etc. Integrative medicine is when you go to a healthcare provider or facility that offers both types of care integrated into one provider and one approach. And this is becoming more and more common. Alternative medicine is the practice of alternative medicine instead of mainstream medical care. So I'm going to deal mostly with complementary medicine today because I think, that's where the most interest for the patient's well-being is. And I'm going to talk about that more, throughout my presentations because, the main point we have to take from these presentations that is everybody should work together because our common interest is the well-being of the patient. So why people choose complementary and alternative medicine? It is a more holistic approach to treating the patient. Some people think it's more natural. It has within it a sense of patient empowerment because patients feel that they're in charge of their fate, in a sense. It's in alignment with personal values sometimes. And a lot of times it expresses a dissatisfaction with traditional healthcare system and delivery. And that applies to access of health insurance, cost of prescription medications, impersonal and sometimes dismissive physicians, heavy reliance on drugs, and conflicting views. And finally, the fact that, it's in the medical profession, there are a lot of diseases we cannot cure. And there are a lot of chronic diseases and potentially fatal diseases. And that kind of, and these approaches open an avenue of hope for a lot of patients. So why do people use complementary and alternative medicine? Let's look at yoga. So 58% do it to maintain health and well-being. Only 16% are practicing yoga to treat specific medical conditions. And back pain is probably the most common condition people are trying to address with yoga. Another one that's very common is arthritis in general, and to a lesser degree in conditions like Parkinson's disease, etc. And but the majority do it for general health reasons. And of those who practice yoga, only 22% said that the doctor recommended it. So this is the National Health Interview Survey from 2012. It appears that it may be already old, but the reason I'm presenting these numbers is that this is the result of an interview of 89,000 people and around 89,000 adults and 17,000 children. And the new one is probably going to come out soon. What you see here is that about 1/3 of US adults and 11.6% of children have used some type of complementary and alternative medicine modality. And that's been kind of stable from 2002 to 2007. The most commonly used modality is natural products, which is dietary supplements other than vitamins and minerals. And 17.7% of adults and 4.9% of children are using at least one type of supplement. So 59 million Americans spend out of pocket on CAM, and that's estimated to be around 30.2 billion a year. And 60%, of the responders of this survey are using chiropractic care, for example, with some insurance coverage. And chiropractic care is perhaps the one modality that has the most insurance coverage. Acupuncture, for example, has 25% coverage and massage only 15%. But still, if that sounds a lot, it's a small percentage of the cost of the healthcare overall. So if this is the whole healthcare spending, which could be like around 2.2 trillion, and that's from 2009, and it's probably just bigger now. The most of it is reimbursed. And the blue and the green is the part of it that's not reimbursed. And still from the out-of-pocket expenditure for healthcare, still the conventional medicine is the bulk of out-of-care expenses that people have. And complementary and alternative medicine is still a small portion of the out-of-pocket expenses. And that applies both to physician visits and products. You see, the blue is physicians, regular physicians, MD doctors, and the green is complementary and alternative medicine practitioners. And here is the blue is the prescription drugs, and the green is complementary and alternative medical products. So it sounds like a lot of money, but it's still a small proportion of what we spend in terms of conventional medical care. So, what are the 10 most common complementary approaches that adults are using according to that survey? Natural products is the most common, followed by relaxation techniques like deep breathing, followed by yoga, tai chi, or qigong, chiropractic or osteopathic manipulations, meditation, massage, special diets, and now we're getting into less and less usage, homeopathy, progressive relaxation, and guided imagery. We could classify all these approaches under 5 big categories: the mind-body medicine, manipulative and body-based practices, whole medical systems, biologically based practices, and energy healing. So under manipulation and body-based methods, you have massage, chiropractic manipulations, and osteopathic manipulations. Under mind-body medicine, we have yoga, spirituality, and relaxation techniques. Under alternative medical systems, we have homeopathy, naturopathy, or Ayurveda, the ancient Indian system of approach of health. And under energy therapies, you have Reiki, magnets, or Qigong. And under biologically based therapies, we classify diets, herbs, and vitamins. So if we look at the trends of the use of a complementary and alternative medicine, you see that things like yoga have been increasingly used over the last decade, over the 21st century, let's say. Massage therapy as well has increased, but it has kind of plateaued or has gone down a little bit. And things like progressive relaxation, guided imagery, or acupuncture have been kind of stable over the years. And when we go to the natural products, the one that has skyrocketed in use is the fish oil and omega-3. And echinacea kind of was saw a very high use in the beginning of 2000s. That's been decreasing since then. And glucosamine and chondroitin, it's kind of stable. It's been kind of stable. And things like probiotics or melatonin have been increasing, but it's a smaller part of the whole market of natural product use. And here in the same category, in the same kind of usage category are products like ginkgo or ginseng or green tea, etc. So what are the important things to know about complementary and alternative medicine use? So there are many forms of complementary and alternative medicine with fair evidence that can be safely recommended. And that's kind of the first statement. So there are a lot of things out there that are safe and could work, perhaps not for everybody, but for some people. But this is true of mainstream medicine as well. There are some forms of complementary and alternative medicine that can be used primarily for placebo effects, and that's still good because a lot of the mainstream medications may be producing a placebo effect as well. Complementary and alternative medicine may be associated with side effects and may interact with other medications, and this is an important point to remember. So the fact that something is natural, quote unquote natural, that doesn't necessarily mean that it's safe. Because, mushrooms are natural, but some of them are poisonous. So I'm not saying that some of the products we buy from the health food store are poisonous, but they are chemicals too, and they have interactions with other chemicals, including some of the medications people take. And I'm going to come back to that later. There's some evidence for some forms of complementary and alternative medicines for some of the symptoms of Tourette. And I would add that applies to some of the people. Much of the information on that's found on the internet is misleading, and that's true of every subject because the internet is a forum that's without an editor. That everybody can post whatever they want, so nobody censors or sorts out what's on the internet. Patients often do not discuss complementary and alternative medicine use with their physician, and that's probably one of the biggest points to take out of these presentations today is that, in order to make this an integrative care, people have to start discussing it with the doctors. And perhaps there is a reason why people do not discuss it with the doctors, because sometimes the doctors are kind of the bad guys. We kind of give patients the party line, which is, we just use my drugs and not their drugs. And here is like the Darth Vader here is the FDA, and that tells the poor patients that I find your lack of faith disturbing. And the poor guy is kind of gasping and saying, I was just taking some vitamins. I don't know why that's such a big deal. So we have to be able to talk to each other. So when we communicate with patients, and that's more for doctors and other providers, is what should we do? We should listen. We should keep an open mind. We should explain and teach. We should emphasize safety. We should discuss risks and benefits the same way we discuss it with the medications we offer prescribed. And we should try to understand where people come from, their specific values. Things we shouldn't do, we shouldn't judge, we shouldn't be dismissive, we shouldn't project our own values onto the patients, and we shouldn't close the door to future conversations and ignore potential risks. Talking to patients. So one of the issues is that whatever they should do should be complementary to conventional medications. And that may not be as important, let's say for your tics, but, it's important when you have a heart condition. Then you need, or you have diabetes, you have to take your medications. And, it may be more important for some of the comorbidities of Tourette's, like depression. This is something that has to be treated. You should involve the alternative practitioners as part of the healthcare team, and both the patient and the doctor should make an effort to involve them. Make sure that there are not drug interactions between the supplements and the medications you take, and make sure you ask about complementary and alternative medicine, and treat supplements like other medications, because at the end of the day, everything is a chemical product, whether it comes from, let's say, from a plant, or whether it comes from a factory of a drug developing factory, from a pharmaceutical company. They're chemicals, and at the end, inside our body, they produce chemical reactions, and they can have interactions with each other, and they can have, and like I tell my patients, there's no free lunch. Every chemical substance you ingest, either a supplement or a drug, has some effects you like and some effects we don't like, we usually call side effects. So we should treat supplements like the other medications, and they should always go in the list of the other medications when you talk both to the regular doctor and to the complementary and alternative medicine practitioner. Advantages of complementary and alternative medicine. It offers alternatives to medication and surgery, may be associated with less side effects, gives patients more control of their own care, which can be very empowering, and could be, one of the first steps into taking ownership and making yourself more healthy in general. Maybe more consistent with people's personal beliefs and values. Offers benefits for some symptoms that are hard to treat, like fatigue, pain, sleep, stress, or mood disturbance. And it may offer hope when other treatments fail. Disadvantages, they often do not have evidence to support their use, may be associated, and as we know, nothing works all the time for all the people. A lot of things work some of the time for some of the people, and that's true both for medications and for supplements. May be associated with side effects and may have interactions with other medications, and that's a very important point. Can be expensive and not paid by insurance. Often is not regulated and may not contain what is claimed, and may delay or prevent more effective treatment sometimes. And a good example, a historical example of that was Steve Jobs. When he found out he had cancer, that he delayed his treatment, the treatment of his cancer, for 9 months. Offers false hope sometimes to vulnerable populations, but that's not always true. An important thing to understand is that while medications are controlled by the FDA, the the natural products are not under the FDA supervision. So, and that started under the Dietary Supplement Health and Education Act of 1994 that eliminated the requirement of FDA approval for natural supplements and put them basically under the USDA. Companies do not have to demonstrate effectiveness and safety before approval. The purity is not routinely monitored, and prescription is not necessary. And to give you an example of what that pertains is that under the FDA, they are not permitted to claim that they cure a specific disease. They can only claim on the label that they affect the structure or the function of the body. So, for example, echinacea. They cannot claim that they cure the common colds. They can only say that they support the immune system, inferring that they may be improving the colds or the flu. Glucosamine, they cannot say that they treat osteoarthritis. They can say that they can improve joint function and mobility. So this is kind of an important point on the claims that are made. So how do we weigh the evidence? It's kind of a hard thing to do because, we're constantly bombarded by claims, and that applies sometimes to mainstream medical products. But the main question at the end of the day, whatever we are doing, is it safe? And that's perhaps the first and most important thing to take into consideration, whether we're starting a new medication or a supplement. Some of the real dangers. Stroke and neck injuries can happen from chiropractic manipulations of the neck because the main arteries that supply the brain go through little openings in the bones of the cervical spine. So when you start cracking it, you can obstruct them and have a stroke. Chinese herbal supplements may contain toxins, pesticides, or sometimes even when I tasted them, they even found Viagra in some of them. Lead poisoning has been reported with the Ayurvedic medications. And in 2015, the New York State Attorney General found supplements offered at major retailers like Walmart, Walgreens, Target, and GNC that they went in randomly and they picked up bottles and they tested them for their contents. And a lot of times they found that they contained cheap fillers like rice and houseplants or substances less that could be hazardous or produce food allergies. So I would say 4 out of 5 times they were not exactly containing what they claimed they did. Cannabis is a big one these days because of the medical marijuana act in many states, and but that cannabis has its problems too. It can cause lightheadedness and confusion, and which is can be a problem, especially with people, let's say, with ADHD, who already have kind of impairment in executive function and attention. Echinacea can cause fatigue and dizziness, and high protein diets may cause constipation and interfere with medication absorption. And these are all the sum of the side effects or the less favorable effects of some of these natural products. So sometimes we have to. That's why when you go to your doctor, you have to list all your medications and all the natural products you take, because a lot of times there are interactions. So here are some of the possible side effects, like echinacea can cause fatigue, dizziness, headache, and GI symptoms. Ginkgo can cause nausea, uh, stomach upset, headaches, and heart palpitations, and so on and so forth. What is interesting and something you also always keep in mind that, as I said, they should be treated as chemicals, and some of them have a lot of drug interactions because they are broken down by the body in the liver, and the liver, when this is done, they can kind of either induce the breakdown of other medications, so you have less in your system, and that could be the case with oral contraceptives. For example, when you take St. John's wort or Kava, you may have you taking the pill and you feel you're protected, but you're not, because St. John's wort may kind of induce those enzymes that break down oral contraceptives, and you suddenly your oral contraceptives are not effective. St. John's wort is one of those examples. That's the examples of herbs that have been proven to work. It was studied in one well-designed study against Prozac, and it worked for mild to moderate depression. But the thing is that it's metabolized in the liver. That means it interacts with so many other medications, like the blood thinners, like Coumadin, for example, or seizure medications, heart medications like digoxin, or antiviral medications for HIV and AIDS, and some chemotherapy medications, and as I said before, the oral contraceptives, the pill. And there was a couple of reports in the literature that first raised that issue, and there were some patients who had taken were on anti-rejection medications for transplants, and they were taking St. John's wort for depression. And then suddenly these people they lost their transplants because the anti-rejection medications did not have enough levels in the blood, because St. John's wort induced the breakdown through the liver of those medications. So this is something you always have to keep in mind. So there are always interactions, because no matter how natural a product is, it's still a chemical that takes part in chemical reactions in the body and interferes with the breakdown of other medications. So we need, more and more we realize that we need to make this integrative. We need to work together. And finally, we need to learn to recognize BS, and that stands for bad science. But anything that claims to cure everything or almost everything cannot be true. So common sense says that if it's too good to be true, it's too good to be true, and that's always true. If it's something is inconsistent with what you know from reputable sources, you should question it. If it's available only outside the U.S., like for example, if they, something is not available here, they tell you, or like, in the Philippines they have the cure for Tourette's. I mean, you should question that. You should ask anything that asks you to stop conventional treatments. You should question that. Everything that's revolutionary or miracle, and everything that relies on testimonials or anecdotal evidence. That means that one person took it and they felt great, and or relies on obscure publications. And finally, everything that has clear profit motive. And that's one example for that is like, and it's outside the Tourette's world, but I see also patients with Parkinson's disease, and there are some places that offer stem cell transplants for Parkinson's patients. And at the best, at this point, this should be only experimental. And these websites, of course, at the end of the page, they ask you for your credit card. Anything that asks you for your credit card, like that, at the end of the page, that have a clear profit motive, is probably something you should discuss with a lot of people and think hard before embracing. And finally, again, I come back to the internet. No, we should not always believe what you hear or we see on the internet. And guess what? It says so right here on the internet. So we going now more into the Tourette's world. So what do people use? So we went in our own clinic and we asked 100 consecutive patients with Tourette's and parents what they've been using. And 64% had used at least one modality of complementary and alternative medicine. 29% has used more than 3 modalities. But our definitions were kind of broad because you see the most commonly used modality was prayer. That's kind of available and empowering for everybody. 64%, 80% never consulted a neurologist before starting, and that's kind of sobering because it's we're supposed to work together here, and we're supposed to know what's happening so we can assess the potential dangers or benefits from every intervention. 47% of the treatments were paid out of pocket, and 56% reported some improvement, which is that's really good. And even if the improvement comes from the placebo effect, that's even better. If we could all get better on, sugar water, that would be swell because we wouldn't have to, consider all the possible side effects of all the other chemicals that are needed to address the symptoms of the diseases we're dealing with. So I'm going to spend like 5 minutes on cannabis for tics. And there are many active components in cannabis. And the main one is the THC, which is the high component, and the CBD, the cannabidiol, which is the one that's been used the most for medical purposes, like mostly for pain, for neuropathic pain, for nerve pain. It's been used for anxiety, for sleep, or for epilepsy, in certain cases of epilepsy. And this is the whole cannabis issue. It's very prominent right now because a lot of states have embraced medical marijuana, and Tourette syndrome is in the list of diseases that qualify you for medical marijuana. So, and what is evidence for Tourette's? There are 7 case studies and this is the list of people who published them. And this is mostly with smoking cannabis, mostly with THC, and these people felt better. But this is no hard evidence because marijuana is supposed to make you feel better. There is another study from Canada, a retrospective review of 19 patients where who were using cannabis, also smoking cannabis, and they came back and they did all the scales we use for tics on them, and they recorded improvements. And there is another structured interview with 17 patients who also recorded improvements. I mean, I think from all the diseases in my field, which is movement disorders and includes tremors, Parkinson's, and Tourette's, etc., Tourette's perhaps has the most preliminary evidence, and there are two studies from Europe, and but they are kind of from one from 1999 and one from 2002 from the same person in Germany, and these are randomized, double-blind, placebo-controlled studies, which is kind of the state of the art of what we require for embracing a treatment. And this showed some improvement, and this was mainly THC. And I think that's promising. And since though THC has a lot of the cognitive side effects of cannabis, and this is something we don't necessarily need for people who might have already, ADHD or problems with the executive function in general. Looking into the CBD, the cannabidiol for tics and Tourette's is a very interesting and promising proposition. Unfortunately, it's kind of hard to get that for research, but that's something I think a lot of groups in the U.S. are working on, and it's something that we need to sort out. So, but when we're talking so far, we've been talking about treating disease, right? But part of what is health? Health is a state of complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity. And that's the WHO definition, the World Health Organization definition. And the second quote is from Hippocrates, and he said that, and he was an ancient Greek physician, he said that the function of protecting and developing health must rank even above that of restoring it when it is impaired. So what does that mean? It means that we have to stay healthy. We have to, and that's part of the complementary medical approach to chronic disease. We have to indulge in all those activities or habits that create a healthy lifestyle. And this is perhaps the most important thing for anybody who is experiencing the consequences of a chronic problem. And the aspects of a healthy lifestyle are physical, psychological, and social. The physical part includes exercise, nutrition, and sleep. Exercise can affect tic, anxiety, and weight control, especially the weight for the people who are gaining weight because of the medications we give them. People with Tourette's should choose forms of exercises that are both mentally and physically involving, so that disengages the mind from the tics. And you hear that a lot of times from patients and families that, he's taking the whole day, and when he plays basketball or whatever it is, he stops taking altogether. We have to beware of overdoing it because of the pressure to perform in competitive sports. that can create anxiety and maybe drive the tics. And finally, some people with OCD tendencies have to be watched to set personal limits because they can also overdo it. Diet has to be well balanced with regular meals that can minimize both mental and physical stress. There are a lot of supplements that have been proposed for Tourette's, for tics and Tourette's. One of them, omega-3 fatty acids, and you saw before that's kind of one of the most popular supplements in general, has not been, there's been a study that's been funded by the Tourette's Association, but it didn't show that it can directly reduce tics. But it was a small study, but it showed some improvement in tic-related impairment for some children. So, it still could work for some people. One study suggested magnesium and B6, vitamin B6, in combination to reduce tics. That was from Spain. That has never been reproduced though. But I've had a lot of people who tried magnesium. There are studies with small effects of omega-3 fatty acids on emotional regulation, oppositional behavior, and conduct in subgroups of children with ADHD. And there is finally an inverse correlation between sugar and ADHD, and that's something perhaps that every mother with a child with ADHD knows. So these things have to be watched in general. Sleep, stress, and of not having slept well can potentially worsen tics. It can make me irritable, so I can imagine the other kids who don't sleep. So we need to maintain sleep hygiene, and that's the most important thing about sleep. Maintain regular wake and sleep times. Sleep approximately the 7 to 8 hours. It's nice. Avoid napping. Avoid caffeine late in the day. Avoid flashing lights and reducing noise during bedtime. And no electronics in the bedroom. And that's perhaps the biggest recommendation from sleep doctors, that cell phones to be outside the bedroom. I think that's the number one reason for sleep problems in teenagers. Cell phones in their bedroom. So psychological lifestyle, and that's perhaps the most empowering part of maintaining health. What are the elements of psychological well-being? Self-acceptance, positive relationships with others, autonomy, environmental mastery. That means the individual's ability to choose and create environments that are suitable to his or her psychic. The finding a purpose in life and personal growth. So what are the techniques? And some of these techniques have been part of the complementary and alternative medicine use in Tourette's. Progressive relaxation, guided imagery, deep breathing, biofeedback, self-hypnosis, and meditation, practicing meditation and mindfulness. So, these are all, and these techniques can be taught by professionals, but all this is a process that requires personal input. And all mastering some of these techniques is empowering because, a lot of times people expect a pill to fix them. It's something that's going to come from outside and doesn't require personal work, and it's going to fix you. It's going to be a surgery or a pill, whether it's a supplement or a regular pill, but that only rarely works. Every disease has an element of yourself creating your own healthy space and learning how to uh, interact with, how to react to stress and how to live with a chronic disease by practicing certain techniques is perhaps the most important part of being psychologically healthy and perhaps reducing your tics. So the one that a lot of families have pursued for Tourette's is biofeedback that measures body functions and gives feedback information about them so you can learn how to control them. And usually, some of them use electronic devices to teach you how to reproduce changes in your body that are associated with relaxation. And that's part of teaching somebody who has no control of their muscles how to control their body. And that can be very empowering. Practicing meditation and mindfulness is the act of being intensely aware of what you're sensing and feeling at every moment without interpretation of judgment. Self hypnosis, where patients are taught to produce the relaxation response when prompted by a phrase or a cue, usually called the suggestion, and all the relaxation techniques like progressive relaxation, guided imagery, and deep breathing techniques. So, consciousness is the combination of being aware and paying attention. Awareness is the background of our consciousness that's continuously monitoring the inner and outer environments. Attention is the process where we focus our conscious awareness, providing heightened sensitivity to a limited range of activity. So, attention continually pulls figures out of the background of awareness, if you will, and they're both intertwined. So, mindfulness is an enhanced attention to an awareness of current experiences or present reality. So, teaching mindfulness has been an adjunct to behavioral and medical interventions to manage response to stress and improve self regulation, which could include tics. There was a pilot study of mindfulness based stress reduction for the treatment of Tourette syndrome, and that involved 18 patients who had 8 weekly 2-hour sessions, classes, and 1 4-hour retreat around the 5th or 6th week. And those people reported that they had improvement in 58.8%, which was maintained after 1 month. So, but as I said before, this requires personal work, and maybe that's why it can be more successful. It's not, that's something that's given to you in the form of a pill. It's something that you achieve, and therefore it puts you at a different level in terms of controlling a body that does things you don't want it to do. Hypnosis. Hypnosis is a very powerful tool. Unfortunately, you have to be able to pick the right provider. And usually, there is an American Society of Clinical Hypnosis, and these are the people who certify hypnosis providers, and there are workshops for that. And hypnosis has been used in for anesthesia, for tooth extractions, for smoke cessation, for delivering babies, and in psychiatry for relaxation and treating anxiety. So most of the literature in Tourette, unfortunately, is case studies. There is one case series that explored the standardized method of training children in self-hypnosis. This involved 33 children and adolescents with Tourette who viewed a videotape series of a boy undergoing self-hypnosis training for tic control, and 79% of the patients trained in this technique reported the subjective improvement in self-control. So this, though, again, I come back to the same point, as was the case with is the case with CBIT, the Comprehensive Behavioral Intervention for Tics. This is something that requires personal work. But if you keep practicing, if you keep doing your homework, I never use that word with the kids because it's another reason to avoid it. But if you practice, you can make it part of your response when those tics flare up in the midst of an uncomfortable, let's say, social situation. So the final aspect of healthy lifestyle, social health, and social health involves practices that enhance social wellness, like building a strong social support, learning and practicing healthy communication techniques, developing the ability to relate with people in a variety of settings, dealing with interpersonal conflict in a healthy and respectful manner, exploring diversity by interacting with people from other cultures, backgrounds, and beliefs, valuing time alone and time with other people, and being aware of the social concerns in our community and getting involved in the community. So all these aspects of health should be part of our health promoting, alternative health promoting system in every disease, and more specifically here in Tourette. So when it comes down, though, to specific interventions for complementary and alternative treatments, so what should the recommendations be based on? Since a lot of times we don't have a lot of what doctors want to see, evidence, hardcore evidence. So the first question, is the therapy effective? The second question, is the therapy safe? If something is effective and safe, that's a no-brainer. Just we recommend it. An example of that would be chiropractic care for low back pain, or acupuncture for chemo, nausea, and dental pain. If something is not safe and not effective, that's also a no-brainer. And if something is safe but efficacy is unclear, like coenzyme Q10 or vitamin E, I mean, if it's safe, as my doctor told me once, just try it. It may work for some people. And but then, you have to be conscious of some limitations here, some caveats. Like, for example, vitamin E, since I mentioned that. Vitamin E is one of those vitamins that can cause problems when you have too much in your body, like cardiac problems. So you have to always be careful with these things. And if it's effective but safety is uncertain, then contact your providers. An example would be the St. John's wort, which can be good, kind of address the depression, but has so many drug interactions that make it kind of problematic in people who take a lot of medications. So, is something safe? Proceed. Then you ask whether it's effective. Or, if it's safe, you can always give it a trial and see how it works for you. But always talk to your doctor. So this will end my presentation today, and I would be happy to entertain questions. Hello?
Hi, Dr. Complementary. Thank you so much for such a wonderful presentation.
Mm-hmm.
I'm just looking through right now to see, it doesn't look like we have any immediate questions. We did have a question asking if the lecture would be available online after the presentation, and it will be for anyone who's wondering. I typed it into the response as well, but we typically post the webinars on our website as well as our YouTube channel within 48 to 72 hours after the webinar. So this information will be available for you after today. Unfortunately, at this time, we cannot offer CMEs or CEUs. And we did just get a question. Dr. Completti, have you ever heard of the use of touch points?
Touch points? No.
Okay.
No, I haven't. I could Google it. No, but
no, that's fine. Right.
I'm joking. But since I made such a point of not believing everything on the internet, but I haven't. Okay.
All right,
it hasn't come up to my attention by any of my patients.
Okay, great. But, and then the next question we just got from someone. I missed the first 20 minutes. My apologies. Is there any advice on Botox?
Yeah, Botox is one of those treatments that is local. It doesn't affect your brain. So we're dealing with a disease where all the medications we give work in the brain. So a lot of the side effects affect brain function. They can make you dizzy, sleepy, they can make you confused, they can change your personality. Botox is beautiful because it doesn't affect the brain. It can only give you local side effects. The problem with Botox is, and the other good thing about Botox, before I go to the problems, is that it works for 3 months. Sometimes a little more if you get lucky. So it's not a pill that you need to take every day. The down point is that you cannot Botox the whole body. It works only for local problems. In our center, it's fantastic for eye tics. It works beautifully. And I had a lot of kids where we took them off terrible drugs, and after injecting their eyes and stopping the blinking, the winking, the raising the eyebrows and all these things, it can do wonders for eye tics. It can work, but to a lesser degree, for neck and shoulder tics. I had a kid who had abdominal tension tics, and he had good results from the injections. But, a lot of times the problem is insurance coverage, because botulinum toxin is a very expensive thing, and it depends on your and it's not an FDA approved indication. So you depend on the specific insurance carriers to approve it or not. And for the eyes, we're good. We can approve the eyes very easily. And I think it's when somebody tells me that, their number one tic is blinking, is eye tics, I go straight to Botox rather than medications.
Okay. All right, great. Thank you so much. And then our next question is more focused on diet. Can you talk a little bit more about diet, such as eating gluten-free and its effect on ADHD and Tourette?
Yes. I mean, I think, the problem with diets is that there is this push, it goes in fashion waves. A few years ago it was Atkins, and then it was South Shore, and now it's vegan, and then it was Mediterranean in between. And I think, sensible diets that utilizes natural products, first produce, not a lot of not dyes or preservatives. This is what we should shoot for. And for especially for the ADHD people, avoiding sugars. So the vegan diet now, from what I hear, even the cardiologists recommend vegan these days. It's a very easy thing to try as long as you are careful to maintain your protein intake. We know that it works the most for the people with celiac disease, but this is a small percentage of the population. But you hear other people who say they feel fantastic when they do vegan diet. And, this is one of those things that I showed you in my little table in the end. If it's safe, fantastic. And it's something that where we have a lot of options these days. It's easy to be vegan these days. So I say go for it. Why not?
Okay, great. Thank you. And have you heard anything about fecal transplant with treating Tourette syndrome?
Fetal transplant?
Yes.
No, I mean, because we had fetal transplants for Parkinson's, but that was a different thing because with Parkinson's, even though Parkinson's and Tourette's affect more or less the same areas of the brain, Parkinson's is more specific. You have lack of dopamine, and that's where the concept of fetal transplants came from. Unfortunately, even though the studies were designed very well, it didn't work. Even if it had worked, it would have been something that would have been hard to maintain. But it didn't work. But it was everything we do brings us closer to where we want to go. And that's something that who said it? Newton said it. He said, "I saw what I saw because I stepped on the shoulders of giants." In the history of transplants in Parkinson's, we first did adrenal transplants, where they took the adrenal glands from the patients and they put them into the brain in a little pouch. And that was horrible and made them very sick, didn't work. And then we did the fetal transplant. And then we did gene therapy, where you injected a live virus into the people's brain. But from all this, we've learned that you can transplant cells in the brain or genes in the brain, and they can get integrated and do what you want them to do. But we haven't been able to do the thing that works yet. With Tourette's, it's a little different because it's not a specific lack of a chemical, what we call the neurotransmitter. It's more of a connection problem. So, and it's harder to address with something like that. And it's a more widespread problem because, and you can see that because it affects the motor function and it can affect the psychological function, and it affects all the projections to the higher integration parts of the brain. So it won't come from a transplant. I don't think the answer won't come from a transplant.
Okay. All right. Great. Thank you so much. And then the next question is about massage therapy. Does massage therapy help? I know it was mentioned, but are there any related studies directly with tic reduction? And how about aromatherapy as well, such as any studies you know of with oils?
No, I mean, they're not. I think massage therapy could work in two ways. One way would be to relax muscles that are overactive. There's some people, especially the people with a lot of neck tics and shoulder tics, which are the worst. I think the neck tics always make me nervous because you kind of in the end, you create a lot of arthritis there. And when I see people taking painkillers for their tics, it's time to intervene. So in these cases, I think perhaps massage therapy can help. It can help relax those overactive muscles that from the burden of continuous spasm. And it can help you relax in general. That would be the effect I would see. So it's mostly safe and it wouldn't hurt. It wouldn't prevent the tics from being generating farther down the road. I don't know that. So, but it's a safe procedure, and if it works for some people, that's fine. Same thing with aromatherapy. I think the main effect of those is probably relaxation, through relaxation and stress reduction. That would be where I see the main effect coming from. But there are no studies on that. Unfortunately, we don't have many studies on a lot of these modalities. But there is the National Institute of Health has a specific institute now dedicated to complementary and alternative medicine. And they offer a lot of grant money for people to study all these things, which is a good way. It's a good first step.
Right. Okay, great. Well, thank you so much. And then the next question is, what are your thoughts on orthotics for TMJ helping to lessen tics?
I don't know where we stand. We're supposed to do a study on that, right? There is that came out of a dentist in New York. I mean, I can see the orthotics affecting tics, uh, face tics, personally, facial tics or lower facial tics like jaw tics and stuff. But I cannot see how a local intervention can affect tics in other parts of the body, let's say the legs or the abdomen. So I don't see what the rationale would be behind that.
Okay,
I'm
all
afraid.
right, good. Thank you. And then just a couple more questions. The next question is, do you have any complementary treatment suggestions for rage attacks?
The rage attacks, I think for the rage attacks, the perhaps working through some of the techniques where you can learn to control your emotions would be where the most effective ones. I understand that's a very big problem and it can be very disruptive for families and it's kind of hard, something that comes up so fast and so explosive, to try to turn it off by, you know, by calming yourself down or by, mindfulness or these kind of things. But I think it's something that requires a lot of a multifaceted approach, and it takes a village. It's between the parents and the therapist and the doctor and the patient, and I think it takes a lot of work and working on those relaxation techniques like the imagery or the hypnosis or the mindfulness would be your best bet for something
Okay.
like that. Hmm.
All right, great, thank you. And we also had a question. Somebody from Mexico wrote in and asked if you can make some recommendations on being that they don't have as much information. Do you have any recommendations for any resources that the family can access to help them more so with learning more about these types of complementary and alternative therapies?
Oh, they're doctors for Mexico, you said, right?
Yes.
Yeah, I mean, there are good doctors who see Tourette's in Mexico too. I think going. We had a doctor from Mexico here with us for 2 months, studying here, who's going to start a movement disorder clinic in Mexico, Dr. Guerra. So they're providers who try hard to create. So just look for them, I think. Dr. Guerra was going to go back to Mexico and start a kind of a multi doctor, like start a more comprehensive approach to movement disorders and cognitive neurology. So, you know, Carlos Guerra is the name.
Okay, great.
Very fine doctor from Mexico.
Thank you.
Hmm.
And moving along to our next question, which of all the complementary medical treatments in children with TS have the best evidence? And would you recommend complementary or alternative treatments as preventative measures for avoiding tics getting worse in the future?
I'm sorry, you're breaking down. For avoiding what?
Would you recommend these types of alternative therapies for avoiding tics getting worse in the future? So as more of a preventative measure?
Yeah, I mean, I'm not sure that there is anything we can do to make it to prevent them in the future. I think tics, the good thing about tics is that the kids have a good chance they're going to get better on their own. But giving them the tools to be able to control that top layer of the tics that's non-biological, that can be controlled by your own will, is the best we can do for them. It's empowering, and that applies both to comprehensive behavioral intervention for tics, teaching them habit reversal and all this, teaching them mindfulness, teaching them how to breathe and relax and you know stop the cycle when it escalates. I think that's the best we can do for the kids.
Okay, great.
And wait for the disease to wane by itself, because they have a good chance they're going to get better. The comorbidities is a little bit of a different issue.
All right. Our last question for tonight. Do you have any thoughts or recommendations or knowledge of music or sound healing, especially with vocal tics in children who are often
On children who are what? I'm sorry, I missed the last one.
Children who are humming or singing often?
No, but that would be an interesting thing. So music, you mean something that you have in your ear? Like listening to music when you're trying to be in the classroom or something? Or
yeah, I'm not sure. There wasn't any additional information in the question. Just wondering if you had any.
But I don't have any recommendations, but I think music has a lot of healing powers for people. And but I would be concerned though sometimes that kids with tics could pick some other vocalization out of the music. But I think in general, music can be healing in terms of stress reduction, on getting you out of the cycle of ticking. Because tics is, there's something that exacerbates them, and then they have a life of their own. And then they go down. And that can happen within a day, that can happen within a year. And sometimes we don't even know if all the drugs we're using work, or just they got better on their own. So anything that you can do to just kind of distract the system or calm the system down, or create, an alternative environment, as is the case, or an alternative response, what the CBIT is trying to teach you, or go to a different happy place, like hypnosis is trying to teach you, or trying to use your senses and being non-judgmental, like mindfulness is teaching you. And music can be part of this. That's where I see it. I see it mostly in the relaxation parts of all those techniques you learn.
All right, great. Thank you so much. And thank you to everyone for submitting your questions. Just to let everyone know,
Thank you for giving me the opportunity.
Of course. And just to let everyone know before we finish tonight, at the Tourette Association, we do have a full-time information and referral staff who can answer your questions if we're not able to cover them tonight. You can email support@tourette.org, or you can also call 1-888-4-TOURET. And thank you again to Dr. Kompoliti. This is all the time that we have tonight. Once you leave the webinar, you will receive a survey on the presentation, and we would appreciate it very much if you would complete that to provide your feedback. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of the webinar. And additionally, as mentioned earlier, the webinar will also be posted on the Tourette Association YouTube channel for those who are unable to participate today or would like to tune in at a later date. We encourage you to reach out to us on social media about this webinar or any other ideas and suggestions that you have for future webinars. And on behalf of the Tourette Association, thank you again for joining us and for taking the time to view our presentation. Have a great night.
Thank you. Good night.